Hello everyone and welcome to week 11 of Healthcare Signals That Matter with me, Meghana Arun Pillai, powered by Intent.Health. This week, healthcare was shaped by evolving public health outbreaks, stronger financial performance across major healthcare companies, continued innovation in drug development, growing cybersecurity concerns, and significant regulatory and legal actions. Here are the healthcare signals that mattered. Signal 1 of the week. Public health response took center stage. The cyclosporasis outbreak continued to expand across the US, with cases rising sharply in Michigan and investigation linking illness to multiple restaurant chains, prompting Taco Bell to remove lettuce in several states. At the same time, US authorities tightened Ebola travel restrictions, requiring exposed Americans returning from Congo to undergo quarantine, while infected aid workers remained under observation. The signal: public health preparedness, food safety, and outbreak surveillance remain critical priorities for healthcare systems. Signal 2 of the week. Regulators and courts continued to shape healthcare. The FDA approved new treatments including an at-home starter dose for Leqembi and Merck's once-daily cholesterol pill, while also pushing infant formula manufacturers to strengthen supplier oversight. Meanwhile, courts revived Tylenol autism lawsuits. Litigation expanded around IVF, vaping products, and medical devices, and vaccine policy remained under intense political scrutiny. The signal: regulation and litigation continued to influence healthcare innovation, product safety, and patient access. Signal 3 of the week. Healthcare companies delivered strong financial performance. Several healthcare leaders reported strong business momentum. Johnson & Johnson, Abbott, United Health, Elevance Health, and HCA all posted encouraging financial results, supported by strong demand, improved cost management, and growth across medical devices and pharmaceutical businesses. The signal: healthcare fundamentals remain resilient despite ongoing policy and reimbursement uncertainty. Signal 4 of the week. Innovation continued across therapeutic areas. Innovation remained strong throughout the week. Novo Nordisk secured EU approval for its Wegovy weight loss pill. Eli Lilly entered the psychedelic medicine space through a multi-billion-dollar deal. And researchers advanced treatment across Alzheimer's disease, cardiovascular care, and precision medicine. The signal: companies continue expanding beyond traditional therapies into next-generation treatment platforms. Signal 5 of the week. Digital health and cybersecurity are becoming strategic priorities. Aetna highlighted simpler prior authorizations and digital tools as a key to rebuilding patient trust. At the same time, Abbott and Clover Health disclosed separate cybersecurity incidents, although both said patient care and operations remained unaffected. The signal: as healthcare becomes increasingly digital, cybersecurity and better patient experiences are becoming equally important strategic priorities. Signal 6 of the week. Healthcare policy continues to influence the industry. The HHS watchdog projected over $5.5 billion in fraud recoveries and savings, while debate around vaccine policy, insurance coverage, pharmacy practices, and healthcare funding continued to dominate headlines. The signal: policy decisions are increasingly shaping healthcare operations, reimbursement, and public confidence alongside scientific innovation. As we wrap up this week's edition of Healthcare Signals That Matter, one trend stands out. Healthcare is becoming more interconnected than ever. Innovation, financial performance, cybersecurity, public health, and government policy are no longer separate conversations. They are shaping the industry's future together. Thank you, and you're watching Healthcare Signals That Matter with me, Meghana Arun Pillai, powered by Intent.Health. See you next week with more healthcare signals that matter.